Detroit is facing a homelessness surge that city leaders can no longer explain away as temporary or seasonal. In the past year alone, thousands more residents have entered shelters, emergency housing programs, or unsheltered conditions, overwhelming a system that was already stretched thin. On some nights, shelters reach capacity before sunset. Outreach teams are forced to decide who gets a bed and who is told to wait, and as winter approaches, the margin for error is shrinking fast. This isn't a slow-burning issue anymore. It's an active emergency unfolding in real time. At the center of this crisis is Mayor Mike Duggan, now under intense scrutiny as homelessness numbers rise while long-promised solutions lag behind reality. City leadership continues to highlight redevelopment projects and economic progress, yet homelessness is growing faster than available housing placements. The contradiction is becoming impossible to ignore. Detroit is spending heavily on revitalization while thousands of residents fall through the cracks of basic survival. That disconnect is where public trust begins to fracture. The impact is immediate and measurable. Emergency shelters report persistent overcrowding. Transitional housing waitlists stretch for months. Families are being separated because the system cannot accommodate them together. Seniors are sleeping in cars. Workers with full jobs are rotating between motels, couches, and shelters because rent has outpaced income. Hospitals are absorbing the fallout, treating preventable illnesses tied directly to housing instability. Schools are enrolling children who have no fixed address, no routine, and no stability. This is no longer a housing issue, it is a full-scale strain on Detroit's healthcare, education, and public safety systems. What makes this moment especially alarming is how quickly the situation has accelerated. Rising rents, stagnant wages, and limited affordable housing construction have collided at the same time. Evictions push more residents into emergency systems that were never designed for this volume. Short-term shelter solutions are being used as long-term fixes. And every delay compounds the damage. Once people fall into homelessness, the path back becomes steeper, more expensive, and far more uncertain. City officials insist they are responding. Task forces are announced. Programs are expanded on paper. But on the ground, the results are painfully slow. Beds remain unavailable. Caseworkers are overwhelmed. Promised housing placements don't arrive on time. The gap between official messaging and lived reality grows wider by the week. And residents are starting to ask questions that leadership has struggled to answer. If the warning signs were visible years ago, if the data showed steady increases, why does the response still feel reactive instead of preventative? This crisis is not affecting a small, invisible population. It is affecting Detroiters, people who grew up here, worked here, paid taxes here, and believed the city's recovery included them. Homelessness at this scale reshapes neighborhoods, strains public resources, and erodes confidence in leadership. And once a city crosses this threshold, reversing course becomes exponentially harder. What you're seeing on Detroit's streets today is not an accident. It's the result of decisions made, deadlines missed, and warnings ignored. And the most disturbing part isn't how bad it's already become, it's how predictable this outcome was. Because the homelessness crisis now gripping Detroit didn't happen overnight. And when you see how it was allowed to grow, the next part of this story becomes impossible to dismiss. Detroit's homelessness crisis did not erupt suddenly. It was built quietly year by year, through a chain of decisions that prioritized speed, optics, and redevelopment over structural stability. Long before shelters began overflowing, the warning signs were already embedded in the numbers. Rents were rising faster than wages. Affordable housing construction lagged behind population need. Evictions increased while emergency capacity stayed flat. These trends didn't happen in isolation, they stacked on top of each other, creating pressure that the city's safety net was never redesigned to handle. By the time homelessness surged into public view, the system was already failing behind closed doors. One of the most critical drivers was the widening gap between income and housing costs. As Detroit attracted new investment and redevelopment accelerated in key neighborhoods, rental prices climbed steadily, especially for units near transit jobs and revitalized districts. But wage growth for working-class residents failed to keep pace. For thousands of households, even a minor disruption, a medical bill, reduced work hours, a missed paycheck became enough to trigger eviction. Once that happens, recovery becomes brutally difficult. Security deposits, first and last month's rent, and credit checks lock people out of the private rental market almost immediately. The system assumes resilience that many residents simply don't have. At the same time, Detroit's affordable housing pipeline never scaled to meet this risk. New housing units were announced, approved, and publicized, but delivery lagged far behind demand. Projects took years to complete. Some were delayed by financing gaps. Others stalled in planning phases. Meanwhile, the number of people needing help climbed every quarter. The result was a structural mismatch. Demand surged now, while solutions were promised later. Emergency shelters were forced to absorb long-term need, even though they were designed for short stays. That single failure, using temporary solutions to handle permanent instability, sits at the core of the crisis today. Warnings were not absence. Service providers and internal assessments repeatedly flagged rising shelter intake, longer stays, and bottlenecks in housing placement. Caseworkers reported burnout and unsustainable caseloads. Outreach teams flagged growing unsheltered populations months before the public noticed. But these signals didn't trigger a system-wide pivot. Instead, responses came in fragments: pilot programs, limited expansions, short-term funding boosts. None of it addressed the root issue that Detroit's housing safety net was operating below the scale required for the economic reality residents were living in. Leadership decisions also shaped the outcome. Under Mayor Mike Duggan, Detroit focused heavily on economic revitalization, downtown growth, and external investment, strategies that brought visible success in certain areas. But those gains were unevenly distributed. Housing stability for low-income residents did not rise at the same pace as development incentives. The assumption appeared to be that economic growth would eventually lift everyone. Instead, it increased competition for housing faster than protections were strengthened. When housing markets tighten without safeguards, displacement accelerates. That pattern is now playing out in full view. Bureaucratic friction compounded the damage. Funding approvals moved slowly. Program coordination between departments lagged. Eligibility requirements excluded people who needed immediate help. Even when money was available, implementation delays meant relief arrived late, or not at all. Every missed deadline added another household to the emergency system. Every delayed placement extended shelter stays, reducing availability for new arrivals. Over time, the system began choking on its own backlog. What makes this crisis especially troubling is that none of these failures were invisible. The data existed. The trend lines were clear. The pressure was measurable. But the response remained incremental while the problem grew exponential. Detroit didn't run out of warnings, it ran out of time. And once you understand how predictable this outcome was, the next question becomes unavoidable. When the consequences were this clear, who decided delay was acceptable? Because the fallout from those decisions is now being felt by tens of thousands, and the cost of reversing course is climbing by the day. The moment Detroit's housing system tipped past its limits, the damage stopped being theoretical. It became visible on sidewalks, inside emergency rooms, in school attendance records, and across neighborhoods that were already operating on the edge. Homelessness is not just the absence of housing, it is the collapse of stability across every system that depends on it. Once shelters filled and overflowed, the city entered a phase where every failure multiplied the next. Longer shelter stays meant fewer available beds. Fewer beds meant more people unsheltered. More unsheltered residents meant rising pressure on hospitals, police, transit, and schools, systems never designed to absorbing collapse as a daily condition. Families were hit first and hardest. Parents juggling low-wage work found themselves cycling between temporary shelter placements, relatives' couches, and motel rooms they couldn't afford to maintain. Children missed school days not because of illness, but because transportation broke down or placements changed overnight. Each move meant new routes, new paperwork, new instability. Educational disruption became routine, not exceptional. Teachers and counselors noticed the same pattern repeating: declining, falling performance, emotional withdrawal. These weren't isolated cases, they were the downstream effects of a housing system failing at scale. Healthcare felt the strain immediately. Emergency rooms became de facto shelters during extreme weather. Patients arrived not only sick or injured, but exhausted, malnourished, and untreated for chronic conditions. Without stable housing, basic care becomes nearly impossible. Medications are lost. Follow-up appointments are missed. Preventable issues escalate into emergencies. Hospitals absorb the cost, and taxpayers absorb the bill. This isn't just a humanitarian crisis, it's a financial one, where the most expensive forms of care are used because the cheapest solution, stable housing, wasn't delivered in time. Local businesses didn't escape the fallout either. Neighborhoods experiencing rising homelessness also saw declining foot traffic, increased security costs, and strained relationships between merchants and residents. Small business owners were forced into impossible positions, balancing compassion with survival, safety with access. Some closed early, others closed permanently. Once storefronts go dark, recovery becomes harder. Jobs disappear, services vanish. The local economy contracts, feeding back into the same instability that caused the closures in the first place. Public services entered a feedback loop of overload. Outreach teams were stretched thin, responding to growing unsheltered populations with limited staff and limited placement options. Caseworkers carried caseloads far beyond sustainable levels, turning individualized support into trudge. Police were dispatched to non-criminal welfare calls because no alternative response existed. Transit workers dealt with overcrowding and conflict in stations that increasingly functioned as shelters of last resort. Each system competed for another's failure, until none could compensate anymore. The economic cost of this collapse compounds daily. Temporary shelter placements cost more per person than permanent housing. Emergency healthcare costs dwarf preventative care. Policing and cleanup expenses rise without addressing root causes. Meanwhile, federal and state funds risk being delayed or clawed back when outcomes fail to meet benchmarks. What begins as a housing issue metastasizes into a budgetary threat, draining resources that could have stabilized the system earlier at a fraction of the cost. Perhaps the most corrosive impact is public trust. Residents watching this unfold see promises without results, announcements without relief. They see visible crisis alongside official messaging that insists progress is being made. That disconnect erodes confidence not just in housing policy, but in governance itself. When people stop believing solutions are coming, cooperation breaks down. Communities fragment, cynicism replaces engagement, and that damage is far harder to repair than any physical infrastructure. And through all of this, one fact remains impossible to ignore: the systems collapsing now are not abstract. They are lived realities, repeating daily, growing heavier by the week. The people paying the price didn't design this system. They didn't delay decisions. They didn't ignore warnings. But they're the ones carrying the consequences, while the decision makers who allowed the pressure to build remain exactly where they were when the crisis began. At this stage of the crisis, the most dangerous lie is the idea that no one is responsible. Detroit's homelessness surge did not arrive like a natural disaster. It wasn't sudden, unpredictable, or unavoidable. It was the result of decisions made slowly, deliberately, and often quietly, budget priorities set elsewhere, timelines extended without consequence, and warnings acknowledged but not acted upon. When Mayor Mike Duggan and city leadership speak about the crisis today, they frame it as a challenge inherited from economic decline, inflation, or national housing pressures. But that framing avoids the central issue. Leadership exists precisely to anticipate pressure before it becomes collapse. For years, data pointed in the same direction. Shelter capacity was not keeping pace with demand. Affordable housing construction lagged behind population needs. Eviction prevention programs were underfunded relative to their cost-saving impact. Federal relief funds were finite, yet long-term housing pipelines were treated as optional rather than urgent. These were not hidden facts. Reports, audits, and internal assessments repeatedly flagged the same risks: overcrowding, bottlenecks, and system fragility. The problem wasn't lack of information. It was lack of urgency. Political decision-making played a critical role. Large-scale development projects moved forward while deeply affordable housing stalled. Zoning flexibility remained limited in areas where it could have accelerated housing supply. Temporary solutions were repeatedly extended rather than replaced with permanent ones, creating a system dependent on emergency funding and short-term fixes. This approach may reduce visible pressure in the moment, but it guarantees long-term instability. When leadership chooses to manage optics instead of outcomes, crises don't disappear, they wait. Public messaging further complicates accountability. Residents hear announcements about task forces, pilot programs, and future plans while conditions on the ground worsen. Promises of progress clash with rising shelter waitlists and visible street homelessness. This disconnect isn't accidental, it's political insulation. By emphasizing intentions rather than results, leadership shifts the conversation away from measurable outcomes. But intentions don't house people. Timelines do. Budget capacity does. The controversy deepens when funding decisions are examined closely. Housing stabilization is consistently more cost-effective than emergency response, yet emergency systems continue to absorb the largest share of resources. That imbalance reflects policy choice, not necessity. Every dollar diverted late costs multiple dollars later. Every delay increases pressure on hospitals, schools, and law enforcement. These downstream costs don't appear in housing budgets, but they explode across the city's balance sheet. Responsibility becomes diffuse by design, allowing leaders to claim partial success while the system fails as a whole. Ignored warnings are where accountability sharpens. Advocates, service providers, and analysts raised alarms long before shelters reached capacity. They warned about seasonal surges, expiring protections, and rising housing costs. These warnings weren't radical, they were procedural. Act now or pay more later. Yet decisive action was postponed, debated, or diluted. When deadlines passed without consequence, the message was clear: delay carried no political cost. Until now, as pressure mounts, leaders face a narrowing set of options. Every response becomes reactive. Every fix costs more. Every delay deepens public anger. Protests, lawsuits, and federal scrutiny become more likely as conditions worsen. Accountability shifts from internal meetings to public confrontation. And once that shift happens, control over the narrative is lost. What makes this moment volatile isn't just the scale of the crisis, it's the timing. Economic uncertainty, public fatigue, and eroding trust converge at the same point. When residents see systems fail repeatedly without accountability, patience evaporates. The question stops being, what went wrong, and becomes, why were the warnings ignored? And if leadership continues to frame this as an unfortunate trend rather than a preventable failure, the consequences won't stop at homelessness. Because the next phase of this crisis won't be quiet, and it won't stay contained. If the current trajectory holds, Detroit's homelessness crisis will not stabilize, it will accelerate. The system is already stretched beyond its designed limits, operating in emergency mode while demand continues to rise. Shelter capacity is finite. Affordable housing pipelines take years to deliver results. Social services rely on budgets that must compete with infrastructure, public safety, and debt obligations. When these pressures collide, the consequences don't unfold slowly. They snap, and the communities most exposed to that snap will feel it first. The long-term fallout begins with housing itself. Without rapid expansion of deeply affordable units, temporary shelters become permanent holding zones. Families cycle through emergency facilities instead of transitioning into stable homes. Children change schools repeatedly, falling behind academically while carrying trauma that classrooms are not equipped to address. Teachers become counselors. Counselors become crisis managers. Education systems strain under burdens they were never designed to carry, not because educators failed, but because housing policy did. Healthcare systems face a similar reckoning. Homeless populations require higher levels of emergency medical care, not because they are inherently sicker, but because instability makes prevention impossible. Missed appointments, unmanaged chronic conditions, untreated mental illness, and substance use disorders escalate into hospital admissions that could have been avoided. Emergency rooms become default clinics. Costs skyrocket, capacity tightens, and the ripple effect reaches every patient waiting for care, housed or unhoused alike. Economic consequences follow quickly. Businesses hesitate to invest in neighborhoods perceived as unstable. Tourism declines, local commerce weakens as foot traffic falls and safety concerns rise. Public resources shift toward crisis response rather than growth, leaving infrastructure projects unfinished and job creation stalled. Productivity suffers when workers lack stable housing, reliable transportation, or childcare. Tax revenue shrinks precisely when the city needs it most. This is how urban decline compounds, not overnight, but relentlessly. Inequality widens with mathematical certainty. Those already struggling fall further behind, while those insulated from the crisis grow increasingly disconnected from its reality. Neighborhoods fracture along economic lines, social cohesion erodes. Trust in institutions collapses when residents see repeateds without accountability. Once faith in governance is lost, rebuilding it becomes harder than rebuilding any structure. And the danger does not stop at economics or infrastructure. Public safety deteriorates when desperation rises. Social services become reactive rather than preventive. Civic stability weakens. Political polarization intensifies as frustrations for someone to blame. History shows that prolonged neglect of basic human needs creates volatile outcomes no city can afford. Yet this future is not inevitable. It is conditional. Every projection depends on choices made now. Funding priorities, legislative timelines, administrative urgency, measurable benchmarks, transparent reporting, real accountability. Solutions exist, but solutions delayed become disasters multiplied. The cost of inaction is no longer theoretical, it is visible in shelters, emergency rooms, classrooms, and street corners across Detroit. The question facing city leadership is not whether the crisis will deepen. It already is. The question facing residents is not whether they will be affected. They already are. The real question is whether this moment becomes a turning point, or the beginning of a collapse that everyone saw coming and no one stopped. Because if nothing changes, the next chapter in Detroit's story will not be written in policy documents or press conferences. It will be written in lives disrupted, futures delayed, and trust broken beyond repair. So what happens next is not just political, it is human, and it is happening right now.